Clostridium difficile is a spore-forming, gram-positive anaerobic bacteria that survives on moist surfaces for up to 6 hours in its vegetative state. When stressed, these organisms form spores that can survive in the environment for months or years. When ingested, these spores germinate into the active, infectious, or vegetative form that can cause diarrhea ranging from mild to severe. A closer look inside the bacteria reveals ribosomes, which wrap around the RNA strands to synthesize proteins. These proteins are essential for cell growth, repair, division, and survival. These RNA strands, or messenger RNA, are made from the DNA. C. difficile contains a circular chromosome, or DNA strand, and a smaller circular DNA strand called a plasmid. Here, the DNA double helix is revealed. DNA is used as a template for RNA synthesis, a process called transcription. RNA synthesis is required for protein production, which is essential for cell growth, repair, and survival. In order to initiate transcription in bacteria, the RNA polymerase binds to a promoter region on the DNA. It then melts or separates the double-stranded DNA to form an open promoter complex, which is a prerequisite for RNA synthesis. The open promoter complex allows RNA polymerase to move down the DNA template towards the enzyme's active site, and RNA synthesis begins. Nucleotides, the building blocks of RNA, are incorporated and DNA information is copied one block at a time onto the RNA until the RNA polymerase reaches a termination site and the completed RNA is released. This RNA then interacts with ribosomes and is translated into proteins. Fidaxomicin is bactericidal against C. difficile in vitro, inhibiting RNA synthesis by RNA polymerases. It induces conformational changes in the RNA polymerase DNA complex and prevents the initial separation of DNA strands, which is a prerequisite to RNA synthesis. Studies showed that unlike other classes of RNA polymerase inhibitors, which bind to the RNA product site and inhibit RNA extension, fidaxomicin exerts its potent bactericidal activity against Clostridium difficile by blocking transcription at an early stage of initiation. Without RNA, protein synthesis cannot occur. This results in cell death. Fidaxomicin is bactericidal against C. difficile in vitro, killing the bacteria rather than impeding its growth. Indications and usage. Dificid, fidaxomicin tablets, is a macrolide antibacterial drug indicated in adults greater than or equal to 18 years of age for treatment of Clostridium difficile-associated diarrhea. To reduce the development of drug-resistant bacteria and maintain the effectiveness of Dificid and other antibacterial drugs, Dificid should be used only to treat infections that are proven or strongly suspected to be caused by Clostridium difficile. Important safety information. Dificid, fidaxomicin tablets, is contraindicated in patients with hypersensitivity to fidaxomicin. Dificid should not be used for systemic infections. Acute hypersensitivity reactions. Angioedema, dyspnea, pruritus, and rash have been reported. In the event of a severe reaction, discontinue Dificid. Only use Dificid for infection proven or strongly suspected to be caused by C. difficile. Prescribing Dificid in the absence of a proven or strongly suspected C. difficile infection is unlikely to provide benefit to the patient and increases the risk of the development of drug-resistant bacteria. The most common adverse reactions reported in clinical trials are nausea, 11%, vomiting, 7%, abdominal pain, 6%, gastrointestinal hemorrhage, 4%, anemia, 2%, and neutropenia, 2%. For complete information, please see full prescribing information for Dificid.